Welcome to In Contact, a news and public affairs presentation by the Atlanta Association of Black Journalists. And now your host, Angela Robinson.
Good morning and welcome. This morning, our conversation on the health of our black men. From 1980 to 2008, the Centers for Disease Control reports life expectancy in this country increased from 70 to 76 years in males and from 77 to 81 years in females. However, life expectancy for black males, 69.7 years, is still lower than that of whites. While the underlying reasons for the numbers vary, for example, poverty, lack of access to care, and having jobs with no health benefits, it is critical that the numbers change. The lives of African American men and their families depend on it. We are very proud and honored to welcome two physicians to talk about the health status of black men. First, we want to introduce Dr. J.E.Bonhomme, assistant professor at Morehouse School of Medicine and senior faculty advisor at Emory University. He is an expert on minority issues and president and co-founder of the National Black Men's Health Network. And we want to welcome prostate cancer survivor Clayvon. Croom is with us, and we're very honored to have Dr. Paul Alphonse, a urologist at Midtown Urology here in Atlanta. He serves as the chief of urology at Piedmont Hospital, and he is the youngest and the first African American to hold that position. It is an honor to have you all with us.
Thank you. Thank you.
Doc, first of all, I want to start and ask you, what was that critical issue that happened that you said, I have got to start the National Men's Health Network? What happened?
Very much the issue that you mentioned, that African American men were not living long enough to collect Medicare or Social Security. We were founded in 1987. The life expectancy for African American men was in the early 60s back then. In Fulton County, Georgia, that is still the case, that it may be below the age of 65 for the average African American man living in Fulton County. We started out doing, for instance, preventive health education, like AIDS education in men's homes and shelters. One of the things that we found that was very fascinating was that we started to realize after just a few months that the health of African American men was adversely affecting the health of African American women and vice versa. We started to realize that the way that we tend to compartmentalize health, to talk about men's health, to talk about women's health, it's not an either-or issue, it's a both or neither. We're affecting each other.
So Dr. Alphonse, when he is hurt, I am hurt.
Exactly.
The child, the whole family suffers.
Exactly. It's so important. Prostate and prostate problems, prostate cancer is an issue that not only involves just the patient themselves, it involves the family. And so once you get into a situation where the patient is affected, it is a group, if you will, type of management in terms of how it affects the male, his ability for him to be able to interact with his wife, his ability to be able to treat and manage the issues that are going on, and to be able to move on to that next step after treatment.
Clayvon, before we hear some of your story that you can share, when I hear both of these doctors saying yes, I love how you put it, we don't need to compartmentalize. It's just not, when I'm sick, he's sick, when the child is sick, the family is sick. So when you are looking at the black family unit, though we're specifically looking at black men, but when you look at that, is it the same collaboration with doctors as well to come together to say, okay, even though you specialize in this and you may specialize in that, but we're looking at a whole family unit? Does that happen?
Definitely. When you look at the opportunity to try to take care of if you will, the entire system, if you will, of the human body, it's not necessarily just looking at just the male from an erectile dysfunction standpoint or a prostate cancer standpoint. It's looking at the entire system, if you will, diabetes, high blood pressure, coronary artery disease, looking at all the things that can affect the human body and trying to definitely get each and every one of those to be better.
And Dr. Alphonse brings up a really crucial point. A man can go to the doctor complaining of erectile dysfunction, and the doctor says, that's not your problem, you have diabetes.
Right.
That's not your problem, you have cholesterol, high cholesterol or hypertension, or something else could be causing the problem. You know, sometimes the erectile dysfunction is just a sign that something's going wrong with the circulatory system or the nervous system or the hormonal system, because we're finding out that now a lot of elderly men are hormonally deficient. It's not just elderly women who have that type of a problem. So really, it's like the tip of the iceberg is what we're looking at.
Clayvon, tell us your story, what you can share. When we look at in terms of, and thank God that you are a survivor and you're here to share your story. We appreciate it so very much, because my $45 question is, I don't understand why black men don't go to the doctor.
Well, my situation is somewhat unique. My father had prostate cancer. And not only my father had prostate cancer, my father's 6 brothers had prostate cancer.
Really?
We didn't know all that at the time.
Sure.
My father, oldest brother, was the first to be diagnosed. Then my father was diagnosed, and my father came to Atlanta, and we met with Midtown Urology, and Dr. Bennett performed surgery to work on my father. So it was something that I was somewhat looking over my shoulder for, but did not know that it was going to surface at 49.
Yes, yes.
I actually had a situation where my PSA level jumped. I went to my...
and then before you go on, just break it all down, what is this PSA level so that everyone can, so we'll know that's something that I guess men need to look for.
Yeah, well, that's something that maybe you all want to address with the PSA.
And I'll have him finish.
PSA stands for prostate-specific antigen, and generally speaking, it stays at a certain level relatively low, but if it increases rapidly over a short period of time, or if it's at a certain high level to start with, it's suspicious for something wrong with the prostate. It's not specific for cancer. It could be infection, it could be
but we know something is wrong.
But generally speaking, if the PSA level is one of the best clues that we have that something is going wrong and that more investigation is needed.
And what is a normal level or low level?
Sure.
Number.
We
it
look
varies
at
with age.
Sure. We look ideally in a black male greater than the age 40. 2.5 is the ideal cutoff.
Is the ideal cutoff?
Correct.
Okay, and what was your number? You see where I'm going? I mean,
it was 2.4. Well, actually, it was 1.8, and it jumped to 2.4.
okay.
And the fact that it jumped, had that little level of jump, was enough to send a red flag to the doctor.
Somebody say, look here. Go ahead,
Sure.
Doc.
He had what is called an elevated PSA velocity. And so if the PSA velocity, the level, if you will, from 1 year to the next, elevates greater than 0.75 within a year, that's suspicious that something's going on that merits evaluation.
And as you mentioned, it doesn't necessarily mean it's cancerous.
Right.
But you also said you had sort of a roadmap. You had a blueprint that, as you said, you were looking over your shoulder.
Yeah.
So go ahead and finish.
Well, over that period of time, I actually was getting checked. I was going to my Dr. Bennett's once a year.
So you were doing all the right things.
And I was going to my family physician in between that. So every 6 months I was getting checked.
Right, right.
So as soon as it jumped, he sent me back to Dr. Bennett.
Yeah.
And Dr. Bennett said, well, we need to check you out. We need to do a biopsy. So we did this biopsy, and I went to a business trip in Orlando. I told my buddies, I said, well, I got this jump in my PSA level. It's probably nothing. It's probably I'm aging, probably getting a little older. And I got back, and he said, look, we have a problem.
Yes.
And that was it.
That was it.
That was it. But it didn't take much for me to decide what to do.
Exactly.
Because I basically spent a lot of my time working with my dad's issue and observing the situation. And in addition to that, unique situation is that Midtown urologists during the early 90s did a study with Howard University. And my family was a part of that research.
My goodness, yes.
Looking at the female's breast cancer and looking at the male's prostate cancer.
Right.
So we had quite a little thing
going documentation. On here. I love how you put it. You had quite a little thing going on.
I was somewhat educated.
Sure.
And educated enough to spread the word to a lot of other guys as well. So
he did all the right things, did he not?
Yes, he did.
Well, why are so many of our black men not going to a regular family doctor or going to a specialist, especially when you have a history of? Even if you don't, we hear about it all the time. Or is that a myth? I don't think so, docs.
I think you have to look at a lot of specifics in black men's lives, sometimes just in men's lives. First of all, how are boys raised? When a boy skins his knee when he's 8 years old, what do they tell him? They tell him brave boys don't cry.
Right,
When he gets her playing football, they say take one for the team. So if he's 50 and having chest pain, what does he say? That's just indigestion. So the point is, boys are taught with the expectation that if they just ignore something, it'll get better with time. Next of all, do black people trust the healthcare system? How many black people have you heard say when black people go to that hospital, they don't come out again? I mean, as African Americans, have we ever heard that? I mean, we hear things like that. Another thing, our work schedules. When is healthcare offered? The same hours that most of us are working. If I'm going to take care of some patients in a clinic, but I feel terrible, what do? Do I cancel my clinic or do I go see somebody? Healthcare is not offered at hours which are conducive to men. Then there's the lack of information. How many people do you hear say prostate cancer?
Yes.
Prostrate means lying flat on your face.
Right.
They did a convenience sample where they just stopped men at random on the street and asked them, what is the prostate gland, where's it located, and what does it do? Half of them didn't know. Now, I'll tell you something even stranger. Sometimes we get prostate cancer screenings, and women will come up and say, do I need that?
That's a totally different talk show.
It just shows how ignorant the public is.
That we're not educated.
If men don't know what the issues are, why should they go to the doctor?
Exactly. We're going to take a quick break. So we want to come back and see what else we need to do so you all won't see so many folks. And I want to keep you in business, but I need everybody to be like Clayvon and go see their doctors and see what's happening with their health. We'll be back in just a moment. Stay with us. Welcome back to In Contact, and we're talking about the state of health in our black men. I do like that quote, Doc. 80% of the way we die is related to the way we choose to live our lives. Now, here was a man, though he had a lot of history in his family. Family's doing test studies, but he's going to the doctor, and he said in the break he was tearing up the herb store and the health food store trying to eat correctly. But this statement does ring true. If, what we put in is exactly can affect what happens within the body.
Sure. Health is so important when you look at prostate and prostate health, and there's a lot of things that have been publicized in terms of the correct foods, in terms of the zinc, the riboflavin acid, the lycopenes, the legumes. These are all things that have been seen to be extremely healthy and extremely beneficial for the prostate. So the more we get educated in terms of how we can put the appropriate foods in, then hopefully we'll be able to minimize the damage that some of the food that we take in does to our body to give us the opportunity to live a longer and healthier life. And
some things we can turn around, though. Can we now, if we eat a certain, certain way and take our certain vitamins or even our health?
A rather surprising statistic is that in certain areas of the world, prostate cancer is much less common than it is in the United States. Here in the United States, it's estimated that 1 out of every 6 men living in the United States will face a diagnosis of prostate cancer at some point in their lives. For black men, the rates are about 50% higher, and black men are about twice as likely to die. But you go to some places like in the Far East where the saturated fat consumption is lower and the consumption of vegetables and fruits is higher, the rate of prostate cancer is 1/8 to 1/10 of what it is in the United States. So it's not an inevitable fact of being male that you're going to get prostate cancer. Again, you can change the odds by the way that you live.
When we look at high blood pressure in the black community, sky high. Diabetes, like you said, sky high. Prostate cancer, so on forth and so on. What are we doing to help change it when we look at, and point well taken of the education, the history, when you're 5 years old, shake it off. What are we doing to help change that way of thinking to get past it so that we can minimize or get rid of a lot of this that's happening to our black men? Because I'm hearing you clearly. If it happens to him, it's happening in his family dynamic.
Right. It's each one to teach one. And the way that we do is by making sure we get into our community. We'll get in our community to educate, whether it's through churches, whether it's through community health fair, We have a program that we've had a lot of support on a yearly basis called CHAMPS, that we are able to anywhere between 2,500 to 3,000 men per year that we bring at the Georgia World Congress Center. And we can do everything from HIV screening, high blood pressure, diabetes, prostate cancer, colon cancer, ear testing, eye testing. And is this free? This is free.
Because you know, the next issue is affordable health care, access to health care. You're working every day 2-3 jobs. You got to work, and if you have a job, you know you better go to work because and we don't have access to health care. Go ahead. I'm sorry.
And so when you get the opportunity to find out what your score is, and when I say your score, I'm talking about your PSA score, then it allows you to get the lead time, if you will, to be on the front end of it, of an issue rather than on the back end when you can't do anything about it. So as the word is getting out, the lines year in and year out are getting longer, and this year it's going to be September the 8th down at the Georgia World Congress Center. The registration is on site, and we will be there from 8 until 3. And we encourage all to bring family members and friends, and there's
everybody.
Great seminars for both men and women.
And I'm sure it's not just the testing, but teaching nutrition and exercise and everything. Clayvon, how did this affect the family? When we talk about if you're sick, that family unit is sick.
Well, my immediate family, in fact, my sons are quite educated on the subject matter, and they were very young at the time. I've watched them around. They asked me a lot of questions about, Dad, will this disease visit me?
Yeah, sure.
What do I need to do, Dad?
Right, now.
And
yes.
They are 11 and 13.
Excellent.
And they're on it. Then I like that.
Yes.
Because they're preparing themselves and they can teach someone else. Also, even in my personal situation, it must be about at least 5 or 6 good friends of mine got checked after I told them about my experience and found out that they had it.
Fantastic.
And they visited Dr. Bennett in your office as well.
And I love how you said, Dr. saying fantastic. Not that they have prostate cancer, but they went up and got something, because it can save their life.
Yeah, it did.
You need to be on a schedule, just like I tell my sister friends, get a mammogram, get a mammogram, get a mammogram, as we look at breast cancer is high. What else is the network trying to do, Doc, to make sure the word gets out in a whole scope of health issues for black men and helping with access? What else is your goal and your mission?
Well, we've been everywhere from Honolulu, Hawaii to Vienna, Austria, you know, all over the country trying to advocate for this thing. But the main thing that we're advocating, we're advocating awareness of men's health issues, but the principal thing is that we don't want men's health to be seen as the enemy of women's health or anybody else's health. It's an integral part of it. Health between the genders is not like a seesaw that one goes up and the other goes down. It's like a rising tide floats all boats. If you don't address health among women, it will affect men. If you don't address health among men, it'll affect women economically, disease transmission, and what have you. The other thing that we try to do is that we try to advocate ways, such as Dr. Alphonse was talking about with CHAMPS, we try to advocate ways to make the healthcare system more male-friendly. Like I talked about how healthcare is offered during the hours that most men are working. Some men can't take off from jobs. They don't have leave, or they'll lose their job, or they'll lose pay. We do it Saturday morning. We make it male-friendly. We make it an event like a group, like going to a football game. Lots of men coming together. A lot of times, what men won't do for themselves as individuals, they'll do in group. And so the point is, we make it more like a group event. The other thing is that women can be very integral and very important in helping men to realize their health issues. You know, women are often more knowledgeable and more expert in participating in the healthcare matters, and so they can help bring their men to these types of events.
And demand that you get
well,
checked.
It depends on what the man's personality is now.
Let me tell you something.
If you
No. I mean, after a while, you have to say, do you not have to say, this is what we're doing today?
Well,
because because I see this not just in prostate cancer, but health across the board. We're at a crisis, and we got enough crisis as it is. So can we at least control that part of the crisis to go in and at least just get me checked out in everything?
And you'd be surprised how our women have been at the forefront of ensuring that our men are getting there. So for the lack of ourselves trying, we are fortunate enough to have strong women in our community who have the wherewithal, who have the understanding, the need to bring their significant other. And slowly but surely, the message is getting through.
And it doesn't necessarily have to be the significant other. It can be your friend.
Correct.
You know, whatever, your church member.
Sometimes it's the children. Sometimes it's the parents.
I love that your sons are saying what they need to know, and are they spreading the word in their own way to other young brothers?
Yeah. Well, in fact, my wife had spent some time with some friends of mine that had the prostate cancer. Actually, it got outside their prostate. So their situation was a little further along than mine was. So they came by and thanked us several times for saving her husband's life, because once it got outside the prostate, it was treated by a midtown urologist again. He had to go through chemo or radiation,
immunotherapy.
To get it in check. Now he's doing fine now.
Good.
But
praise the Lord.
At the time, he came to me and said, you know, if you hadn't told me that, I don't know what my state of affairs would have been. Because he didn't have any clue. And in fact, this disease itself, there was nothing affecting me.
Did you have any symptoms?
Nothing.
You just had family history.
Once, I believe for the most part, if it surfaced where you're feeling something, or like my dad had a lower back pain, it was too late.
Then we waited too long.
Then it had got outside his prostate and penetrating to his bone. Then we're in a different phase. You're in a different situation.
Yeah, we're in a different situation, and so we don't want that.
Correct. And I tell people, when it comes to prostate cancer, it is the second silent killer, just like high blood pressure. People walk around, have high blood pressure, and really do not understand or sense anything. And it's just like prostate cancer, especially we're fortunate enough now to live in a day and age where we can catch it early, so you do not have the symptoms. Back in the 50s and 60s,
we didn't know.
Didn't have it.
Didn't have.
You did have the symptoms.
Well, the usual presentation back then was a man coming in complaining of back pain, and the reason why he had back pain was because it had already spread to the spine, which is a very tragic situation.
Yeah, because then there's very little that can be done.
But one of the main reasons why black people have such poor outcomes, for instance, black men dying at higher rates of prostate cancer, black women being diagnosed less frequently with breast cancer but dying more of it, is just because we present late. So people are arguing about whether we should screen for prostate cancer or not. I think that's ridiculous. I think a disease that has no symptoms and that can be addressed early, I think we're ethically and morally obligated to screen for it.
To screen for it, absolutely.
And to advocate screening for it.
And to advocate for screening, yeah. And we don't want people to be hypochondriacs, but go in and get stuff checked out. Bottom line, you know, we did talk about what we put in. Are there any specific things when we look at our history, historically, of black men, when we're talking about nutrition? Now, we had a slight chuckle because we laughed because he was spending all his time at the health food store and getting herbs and whatnot, and I'm sure that can help alternative medicine along with prescribed medicine, or however. I believe that can work in tandem. It should be one or the other, but it depends on the illness, of course. But what else when we look at that history of black men and where we are now and the stress and the so on and so forth, what are we talking about in terms of nutrition that's a must-have? I believe that women need to take my fish oil, they tell me. And they said, so I'm eating fish oil, you know, and eating certain foods.
Vitamin D is crucial.
Vitamin D or
D? D is in doll. Vitamin D is crucial. It's been seen to be extremely beneficial in terms of prostate and prostate health, delaying the onset of certain neoplasm, or if you will, cancers, if you will. And so even though it's not a miracle supplement, it has had a lot of promising areas, and that's one of the things that we stress. And we want to get that number greater than 30. So we initially will screen for vitamin D deficiency and appropriately replace it, and then to ensure that they stay at an appropriate level.
So that's key. That's key. It's key.
I think one of our problems as a people is that we learn to eat for the plantation. You know, we eat a lot of animal fat and grease and a lot of salt. And back in the days when you didn't have refrigeration, salting your food helped prevent it from spoiling, so that made sense. If you were working on a plantation and sweating all day, eating a lot of salt probably wouldn't hurt you. When it was hard to get enough calories to survive on, adding fat to your food would probably help you. But now we're sitting at a desk, and those things, that's a killer combination. We need to eat less processed foods. We need to eat more fruits, more vegetables. People don't have to be absolute vegetarians, but
Right.
we need to cut down on the animal products and get most of our food from unprocessed plant foods.
And that's good advice for all of us,
Yeah.
male or female. Clayvon, I've got about 30 seconds left. If you have one message you need to send out to your brothers and to the family, I'm going to let you take us out. What would you say?
Get checked.
Period.
And don't hold back. And spread the word. Because one thing I've noticed about some friends of mine that have had prostate cancer, they will not talk about it. They stay silent. They don't spread the word. Reach out. You can save someone's life.
Enough said. We thank you so very much, Doctor, for all your work and everything that you're doing, especially with the network, and you all are saving lives over in Midtown. We have a website, though, we want to make sure that everyone can get some more information. It's nbmhn.net. Go there and get more information, and I think Mr. Croom has said it all. Get checked. Get checked. Educate ourselves and spread the word. Thank you, gentlemen, for being here.
Thank you for having us.
Okay, thank you. As always, we want to thank you for joining us. We're in contact with you. You stay in contact with us. We will see you the next time.